Assalamu alaikum. My name is Dr. Abdul Rauf Sheikh. I'm a cardiologist in Adelaide. Thanks for inviting me. Alhamdulillah, Ramadan has started and we all are fasting. So today they have asked me to discuss about patients with hypertension. In layman terminology, the patients who have high blood pressure and they're taking medications for blood pressure, and how they can, question is whether they can fast, and if they can fast, how they should adjust their medications accordingly. So first of all, when we talk about chronic medical conditions, if they are stable, so the important question is whether you can fast or not. So the stable chronic medical condition, most of the time you can fast, but I normally recommend you should plan it ahead. So if you have any chronic medical conditions such as diabetes or high blood pressure, so you should discuss with your GP well in advance and go through all your medications you're taking and see whether we can adjust these tablets accordingly and make it more easier for you to fast while taking all these medications. Nowadays, most of the blood pressure medications which we prescribe, they are 24-hour acting and we can take them once a day. And if you're already on some medications which are twice daily or 3 times daily, there is always a chance that we can adjust them to either twice a day or once a day. So it is important you discuss with your GP well in advance before you start fasting. As I said, most of the time we can fast easily without any problem. When we talk about what to do when you're taking blood pressure medications and if you fast and you're fasting along with that, my first advice is that at the time of suhoor, you take your blood pressure medication, and especially if it is longer acting for 24 hours, that's more preferable. And when you get up in the morning for suhoor, so ensure that you keep yourself well hydrated, drink plenty of water, take medications, and avoid excessive salt intake and avoid excessive carbohydrate intake such as excessive sugars. So, and during the day when you're fasting, if you feel unwell or if you are dizzy, if you have headaches, please check your blood pressure at home. You should have your blood pressure monitor at home, and you should be aware of the fact that you can do it easily at home and check it. And if the blood pressure is low or if it is very high and you're not feeling well, you should straight away break your fast and have something to eat or contact your GP. Basically, Allah knows the best, but if you are unwell, there is no harm in breaking the fast at that time. But as I said, most of the time, without any problems, you can continue fasting if you have enough hydration at the time of suhoor and you've taken the medication at the time of suhoor. Now coming to the breaking of fast, most of the time when we break the fast, there is always a tendency that we eat too much and we take a lot of junk food as well, which is most of the time is lot of salt in it. So patients with hypertension, they can very easily get a spike in blood pressure, raised in blood pressure if they eat too much salty food and too much salty meal. So the first advice, keep yourself hydrated, avoid excessive salt and eat healthy. Second question which a lot of people ask, that what should I do if I have medications, multiple medications to take, and the timing is different, some in the morning, some in the afternoon and some at night time. And this question has been asked multiple times. Some of patients come to my clinic as well and ask us. For this, as I said earlier, you should plan it properly, and we can always curtail your medications to adjust them according to the timing of the fast. So some medications you can take in the morning at the time of suhoor, and some medication you take at night time after breaking your fast. And keep yourself hydrated. That's the most important advice, because we're in the summer with the hot weather, so avoid dehydration, which is not good if you have high blood pressure. In the end, I would say that we should all fast. There is no problem if you have chronic medical conditions and if they are stable. For the blood pressure, take your medications preferably once a day, keep yourself well hydrated and avoid extra salt. Thank you very much.